Hello, my name is Ryan Sitter. I'm a second-year pharmacy student at Midwestern University. In Workshop 1 today, I'll be going over blood glucose meter counseling with MP, who is a 45-year-old white female presenting with a 4-year history of hypertension and a 2-year history of type 2 diabetes mellitus. She arrives at the pharmacy to pick up her prescription for a blood glucose meter, test strips, and lancets, and explains that her doctor has instructed her to test her blood sugar at home for the first time, as he anticipates insulin therapy may be necessary to achieve her A1C goal. She is worried because she has never used a blood glucose meter. When asked how many times per day she was instructed to test, she replied just once in the morning before breakfast. Blood glucose monitoring is important to maintain safe blood glucose levels and to assess whether your blood sugar goal is being met. Today I will be counseling this patient on appropriate technique of obtaining blood glucose readings. Then I will present a few steps to ensure accurate testing, and finally I will explain to the patient how to document the SMBG data. First, how to obtain an appropriate blood glucose reading. MP will want to wash her hands and then insert the test strip into the meter. Next, using the lancet device on the side of her finger to get a drop of blood. The side of your finger ensures a less painful process. And next, she will hold the test strip to the drop of blood and wait for the result. After the blood glucose level is displayed on the device, MP should dispose of the lancet in the sharps container, such as a laundry detergent bottle. The next step is ensuring meter accuracy. Some steps to take to make sure MP will get an accurate reading include properly storing the meter, as well as the test strips in a cool and dry place. Also make sure that the test strips have not expired. Finally, getting an adequate blood size and having clean and dry fingers will ensure accuracy. Finally, MP should be documenting her self-monitored blood glucose level. For MP, she has been instructed to document her fasting blood glucose levels every morning. Depending on the device she uses, she can track electronically directly on her meter, or she can use a written logbook. To ensure MP is achieving her blood glucose goals, she should bring her blood glucose documentation whenever she visits her provider. For MP, using these 3 steps of properly obtaining blood glucose sampling, ensuring accuracy while obtaining the sample, and proper documentation will show whether or not she is on track to meet her blood glucose goals. Thank you.